Hello, Chad. Good afternoon to you. How are you today? Wonderful. I'm great. And you know what? I have something for the heart for you, Chad. In fact, we are speaking with wonderful people and very expert at their field from the Asian Heart and Vascular Center in Singapore, and they just came to very hot Cebu City to talk about a lot of advancements, especially in cardiology, and it's so inspiring, Chad. That's why we have Dr. Edgar Tay and Dr. Pipin Jojo with us this afternoon. So please allow me to chat with Dr. Edgar Tay. Dr. Edgar Tay, thank you so much and welcome to Cebu City.
Thank you very much for having me.
Yes, it's really great what you shared with us earlier today. It was very insightful, and the breakthroughs in medical tech in medicine is just very amazing.
Yeah, we're just very happy to kind of share that there's so much new things coming along in the field of cardiology that allows things that couldn't be done before. Patients who are too frightened or too sick to be treated can now be treated and have access to alternatives. So I think it's just so happy for us to be able to share this information with all the people in Cebu.
Okay, yes, you said about being scared, right? Because when people think of heart surgery, they think of saws and big scars, but you're doing something different. It's called a pinhole heart repairs at the Asian Heart and Vascular Center. How is this new technology allowing you to fix the heart without leaving a major mark? That's really new for us.
Yeah, so that in the past, in order to get to the heart, the traditional way was to open up the chest. Like you said, you require literally a saw, and then open up the chest, and then doing surgery and cutting the heart. But these days, we're always striving to reduce that trauma that patients have to undertake. And so these catheters that we have devised now is catheters that are probably the size of smaller than our pinky.
Wow.
And then these could go through the thigh arteries, just like how we do patients with, stents in the past, people with blocked arteries. Similar technologies have been devised to put in catheters through the thigh and then allow these catheters to reach the areas of concern. So in the situation of heart valve disease, we can actually bring these catheters and devices to the heart valve specifically and target treatment where it's necessary. So this allows them to actually not have the patient require kind of anesthesia, deep anesthesia.
Wow.
Doesn't require stopping the heart, and definitely no trauma to the chest at all.
Did you hear that, Chad? That is unbelievable, because that's not the way we see. Even in medical dramas, you still see them use probably the saw, but this is like, it's very pinhole. And how long does it usually take, Dr. Edgar?
So it depends on which valve we're treating. So we just give an example of what we call the aortic valve, which is one of the most common valves that we treat. This procedure probably takes about 90 minutes.
Wow.
From the point we start to the point that we end. So it's a pretty short procedure because we don't really have to worry about, say, bleeding or wound injuries, and we don't definitely no stitches are required here. So that's why we can keep it kind of short and sweet.
You know, it really, honestly, I mean, if I'm wide-eyed right now, is because it's unbelievable. But isn't it great to be alive at this time and an age where you have medical advancement that way, that it won't take you long to be operated on and to find way to lengthen your life.